Hi guys, my name is Eve and I was diagnosed with breast cancer, and on November 1st I had a double mastectomy. Today I'm going to show you how to do the draining for the double mastectomy. The first thing you have to consider is you have to be sterile. So I'm going to wash my hands here with soap. Okay, so that's done, and then I am going to dry my hands just so we're not transferring any germs or getting an infection. Before, in the early days, my niece was doing that for me. She was helping me because I had just had the surgery. It was over 6 hours and I was unable to do anything for myself. So if you're doing it for someone else, make sure you get some gloves and put them on. I am not going to put on these gloves because I'm doing it for myself, so I can't transfer any diseases to myself other than stay sterile. Here I have alcohol prep wipes and I'll show you how to use those. And then over there, I have my chart, which I have to record. I have to drain morning and evening, and I have to record that in mLs. So because I'm doing this myself, I just want to make it simple. I've labeled the cups. This is cup 1, cup 2, cup 3, and cup 4. And then as you can see here, I have these tubes hanging off me. These are the draining tubes that hold the bulb that has the drain in it. And right now it doesn't look that bloody. It's getting more clear because it's day 16. And then on my right side I have 2 more tubes to drain. So I will start with tube 1. So first of all, I have to squeeze out any liquid which is stuck in the tube into the bulb, the drainage bulb. Okay, so that's once. And then I'll do that again. Just squeeze it and pull, and all the liquid is going to be suctioned into the bulb. This is a one-way bulb, so nothing can go back up there. It just goes down into there. So once I'm finished doing that, I'm going to open this, and as you can see, when the air goes in, it blows up, and this is labeled number 1. So I'm going to pour that into there. They want you to record this in mLs. And if you don't like seeing any blood items, please do not watch this video. I should have said that in the beginning of the video, but I am just an amateur. I'm not a professional, so I'm just doing things as I think about them. Okay, so what I like to do is I like to, after I've drained, I like to rinse it out. So I will squeeze the bulb to let some air out, and then I'll put water and just let go. It suctions the water. I just shake it and squeeze it out. So the way it drains is that it uses suction. So I have to push out all the air in the bulb, and I go even a step further because I fold it, and then when I put the cover back, the clip, it's flat. So when it starts draining, it'll only come one way. It goes all the way down. So that one is done. That was number 1. And then now we go to number 2. You see, this one is more filled than the other. So I am going to make sure that I drain the tube. So that it's empty. Drain the tube. Okay, so it's empty, so we'll do that one more time. Like I said, this is the first time for me doing this. I've never had experience, but I'm doing this video hoping that if someone should go through this and they're alone or they have family, that family can help them. So you see, this one has more liquid than the other, and this is number 2. So I'm going to unplug that, and then I am going to pour it into cup number 2. You may see like pieces of little fat in there, and that's normal. It's nothing to be concerned. As long as there's no infection, there'll be no smells, and it does stay sterile. This is day 16, and I have not had any problems with that. It's just hectic and cumbersome to have to go through that. So I will fold it again to let out all the air, and then I will plug it, and then it's done. So what this is meant for, actually, the alcohol wipe, when somebody is helping you, is to just kind of, they're wearing their gloves, they'll wipe this for you to just keep it sterile for you. Okay, and so that's done. We're going to go to tube number, no, that's 4. Let's get number 3. So we're going to go in order. So this is number 3, and that's cup number 3. And what I'm going to do is I'm going to open this little spout here on the side, and then it blows up, and just pour the drainage in there. Before it was blood. Lately, sometimes it's clear, sometimes it's orange, sometimes it's the color of urine, because the blood vessels are realigning, and so there's not that much blood coming out. And I forgot to drain it on the side, so we're going to do that, even though I did empty that. So as you can see, this one has stuff in it. That's just adipose tissue. It's been in there for days. Sometimes you can get it, sometimes you can't get it, but don't worry about it. There are no germs in there. It's sterile, so it's not going to infect me or do anything. So I'm just going to empty that and make sure it drains in there. Once it's done, I'll open this again because I had forgotten, and then I'll just pour it into there. And I have my mLs, and I'm going to wash it. Suction water into that, shake it a little bit, pour it out. It's clean. And then I am going to squeeze the air out, and I go a step further. I fold it to just get more air out and get the suction stronger. Then I take this little friend over there, put it in there, close it shut. It's done. Okay, so now I'm going to go to number 4, and since we had forgotten with number 3, I'm not going to forget this one. So once again, push the fluids that are draining from my double mastectomy chest area. Okay, one time, and then we do that again. Just push it down till we get all of it or most of it, and there we go, we're done. So now I'm going to open this little spout on the side here. So just pull it up and it blows up because the air has entered. Then you pour it out, try and get most of it, and then I am going to clean it. I'll pour water into it, squeeze it, suction the water, shake it, pour the water out. And just so you know, nothing smells. So I'll squeeze it again and fold it to try and get all the air out so that it can suction, and then shut that. And I'll wipe this area with my alcohol wipe, and I'll wipe the other one with the alcohol wipe, and that's done. So these tubes are attached to my body with some sterile tape. It's like plastic. It's day 16, so it's beginning to come off, and then they go up into here, up on top of my breast and into there. Let me just move my hair. So they go up into the skin, on top of my breast, into inside there, and they start suctioning the drainage so that I don't get inflamed from a lot of water. And also this area is near the heart, so they want to be very careful. So my breast tissue was completely removed. I have no breast tissue, just muscle and skin. And then they did place expanders in there. So every week I go to the doctor. The expander is pretty much a plastic with the metal on the back and the metal on the front. So what they do is they inject air into the expanders a little each week, just to grow the skin and extend it, so that eventually when they reconstruct, there's room in there. So that's what it does. And the metal plate behind the expander is so that when they inject the air with the needle, it doesn't penetrate and then go to your heart or just injure some organs. So that's why they do that. So it's going to be a long process to heal. I'm exhausted, but what can I do? It's better than having the cancer grow from stage 1 to stage 2 to stage 3 to stage 4, and then, you know, your chances of surviving are very limited. And then I have a chart here that they gave me, and every morning and evening I have to enter how many mLs that I got, and it's listed, you know, I have cup number 1. So I'm going to look here. This cup here has let's see, you're supposed to look at it at eye level. It has about 2 mLs in there. So cup number 1 is going to be 2 mLs. And then I have cup number 2. So let me look at that one. That's going to be about 22 mLs. So cup number 2 is 22 mLs. And then cup number 3 is going to be about 19 mLs. So That's 19 mLs. And then cup number 4 is going to be approximately 8 ml. So that's 8 ml. So each cup varies. Sometimes 2 of the cups will be the same. And then once I'm done with that, okay, usually I'll just tuck these into my biker shorts, or I have some vests that I wear that have pockets to put these things in. So since you don't need to see that, I'm going to untie this. And then the next thing I'm going to do is just empty these cups and clean them. And you can reuse them again if you like, or you can use a new cup each time. I'm pretty frugal, so I like to save on things as long as it's a sterile process. Okay, and then I am going to take the alcohol pad and stuff, and these will be tossed away. And I'm done. I'm going to wash my hands again. And we have completed the process of draining the tubes that were inserted in me because I had a bilateral double mastectomy. I'm trying not to use a lot of medical terminology. I'm trying to use layman words so that it can be easy for most of the population to understand, because sometimes we assume that everyone understands the language in the field that we work, and it's usually not the case. And then they have to ask questions again. So thank you so much for watching, and thank you so much for coming on this journey with me. You have a good evening. Bye-bye.